Good afternoon, everyone, and thank you for joining us. My name is Tara O'Leary, and I'm the Manager of Alumni Relations at the Leslie Dan Faculty of Pharmacy. Before we start today, I'd like to acknowledge the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of Indigenous people and remains the home for Indigenous people across Turtle Island. We are grateful to have the opportunity to work on this land. Thank you for joining our webinar today on occupational stress and burnout, a role for resilience. This webinar is part of our alumni networking and education series and is brought to you by the Office of Advancement at the faculty. The series was launched last year to provide you, our valued alumni and friends, with relevant, thought-provoking presentations and discussions on current hot topics in pharmacy and pharmacy practice. Many of the event topics have come from your feedback, so thank you for your input. I'd now like to welcome our speakers today. Both bring a wealth of knowledge and tangible lessons and tactics on incorporating and improving our resilience. Jamie Kellar is an associate professor teaching stream and acting director of the Doctor of Pharmacy program here at the faculty. Jamie received an honors Bachelor of Science degree in human kinetics from the University of Guelph, followed by a Bachelor of Science in Pharmacy and a Doctor of Pharmacy degree, both from the University of Toronto. Currently, she's a PhD candidate in the School of Health Professions Education at Maastricht University, Netherlands, where she uses Foucauldian critical discourse analysis to study pharmacist professional identity. In addition to her education, she's a licensed pharmacist in Ontario. Professor Kellar's practice area is in the field of mental health. Maria Zhang is a clinician educator jointly at the Center for Addiction and Mental Health, CAMH, and at the Leslie Dan Faculty of Pharmacy. Maria completed her post-secondary training at the University of Toronto, with her graduate work recognized by the Department of Pharmaceutical Sciences and the Collaborative Program in Addiction Studies. The focus of her research and her teaching is addictions with a specialization in problematic prescription drug use. She is also interested in knowledge translation and supporting the continuing professional development of pharmacists. Welcome, Jamie and Maria. Maria will be starting us off this afternoon. Thank you.
Thanks so much for the introductions, Tara, and to all the, I guess, everyone in the background pulling this together so that we have such an exciting topic that I think is highly, highly noteworthy for us all. I think, occupational stress and burnout, Jamie and I saw the high number of individuals who registered for this event. So hopefully it actually translates into the number of people who are actually able to attend today. I think part of the interest is just related to the fact that this is something that we might be experiencing in some way, shape, or form, particularly given the COVID-19 pandemic. So what Jamie and I are really striving to do over the next 35, 40 minutes through this didactic presentation followed by Q&A is to highlight that occupational stress and burnout do exist, particularly within our pharmacy profession, how they're different from each other, and really thinking about some practical solutions, both from an organizational level and also at the level of the individual in managing stress and or burnout. Specifically, what is the role for resilience? So before we move any further, certainly we'd like to acknowledge Dr. Zubin Austin, who I think to many people, perhaps even on the line, is a mentor, is a colleague, and certainly has co-presented with Jamie on this topic multiple times. You may have caught them at a CPHA event in the recent past. So hopefully, as I mentioned, by the end of the session, you'll all be able to describe the situational context of occupational stress and burnout, particularly within pharmacy practice settings. As I mentioned, the role of organizations versus individuals in burnout, and especially for people in management or leadership positions, thinking about how can we manage our own stress and burnout levels, but also thinking about the people who we provide support to, and thinking about as a manager or as a leader, how to minimize some of the stressors at work, and what we can control and what perhaps we can't. Third, identify personal risk and protective factors related to occupational stress and burnout. And lastly, I think Jamie is going to take you on some excellent activities to reflect upon some personal strategies that can be implemented to help prevent occupational stress and from feeling burnt out. So I think this is a typical pharmacy retail setting, whether you work in hospital, academia, industry, community pharmacy, wherever it might be. We want to open up the question to you and engage you in thinking about, one word that describes what's happening in pharmacy right now. What's specifically keeping you up at night? You can see that we have a poll everywhere poll happening. So you can feel free to log in with pollev.com/NYZ302 or text NYZ302 to 37607 to let us know anonymously what's kind of keeping you up at night and contributing to perhaps some of the stress that you may be experiencing as it relates to what's happening in pharmacy now. So we'll give it a couple of moments so that everyone can kind of put their thoughts in one word and launch it within this poll. So again, feel free to either type it in to pollev.com NYZ302 or text. One word. Wow, that's a striking word. Thank you for sharing. Thankless as one of the things keeping you up at night. Demanding, the workload, the work itself. Stress, one of the key words that we're going to be talking about today. Perhaps making the right decisions, the responsibility that we're perhaps all feeling at this time point. Overworked. Thank you all for sharing. I think, one of the benefits of having these kinds of polls is to see that, even if you perhaps didn't have time to enter in a word, maybe some of these words resonate with you in terms of, feeling like there's high demands, high stress at work, feeling like, you're in a thankless position, or maybe even, something as significant as a thankless profession. Thank you all so much for contributing. So we're going to build upon some of the pieces by thinking about this burnout self-reflection questionnaire. And as funny as it looks on the right-hand side, a Cosmo quiz, this just kind of helps you ground the questionnaire that you see to the right. So this isn't actually a screening tool, unlike some of the different ones that you may encounter within your primary care setting. So this is actually just a questionnaire that's designed for healthcare professionals in an initial, relatively low stakes assessment around, how are you feeling, and checking in to see, are you at risk of burnout or not? So let's take a moment to go through these questions, and specifically, let's count how many of these statements you personally agree with. On most days, I start my workday feeling energized. Agree or disagree? I leave work most days feeling that I accomplished something worthwhile. I have friends at work. I feel supported at work in career development. I spend at least 20% of my time, so 1 day a week at work, doing work that I find personally fulfilling. I find it stimulating to work with colleagues. I'm operating at the top of my license, or in other words, to full scope. My immediate supervisor treats me with respect and dignity, and I have the resources I need to do my job. Chaos in my work environment is not the norm. So take a minute to see how many of these agreements you agree with and tally that up out of 10. So maybe it's hopefully 10 out of 10, but if it's anything less than that, we want to know as well. So how many of these statements do you agree with? I'll give it one more minute before we start collating everyone's responses and see what the general feel is. All right, our second poll. How did you score on the questionnaire? So somewhere between 0 and 2, 3 to 7, or 8 to 10. Again, there's no right answer per se. It's a good way for us to just get a gauge of who's in the room, the virtual room, and a sense of, how close are we all to, burnout in particular. Thank you for those responses, everyone. So it looks like, we have a pretty even split between the 0 to 2. We're changing a little bit between, 3 to 7 is perhaps where most of us are landing, which makes sense because, numerically, that's the most number of numbers, the range of 3 to 7. So 3 to 7 represents that, we may be at risk of burnout depending on how close you are to 3 versus 7. And what Jamie's going to be doing in the latter portion of our webinar is going to be going through some strategies as it relates to self-care and, how do we move closer towards a 7 or an 8 to a 10 rather than a 3. Again, knowing that some of these things are outside of our control. A 0 to 2, what that represents is perhaps, you're feeling more depleted, more drained at work than feeling fulfilled. And I think this is a situation where, apparently 17% of the respondents in this webinar, 14%, better, that's a little bit lower. This is where we're starting to perhaps display some of these signs and symptoms of chronic stress, of higher amounts of burnout. And again, the application of some of the different exercises that Jamie will be going through will be quite important for you as well. One addition to that is perhaps, seeking out, if you haven't already done so, a connection, whether it's a trusted colleague, a friend, to start thinking about, what out of those different questions really strikes you as something that you need to perhaps change, whether it's personal or work related. 8 to 10, it looks like a third of us are in that range of generally feeling more fulfilled at work than feeling drained. And, there's homework in this category as well, which is thinking about, what drives your agreement to some of those statements, what makes you feel fulfilled at work, and use those as one, coping strategies, perhaps when stressors do become exacerbated over time. And then 2, thinking about different coping strategies that you can correlate with that. So there's homework for all 3 categories, fortunately, unfortunately. And, this is an exercise that I would encourage you that you do with your teams as well. They don't have to necessarily share their scores with you, but I think it's a good exercise, even if it's a bit Cosmo quiz-esque, to get a sense of how people within your organization or within your store, for example, are doing at this time point. So as I mentioned, this is just one example of a quiz. This one is a bit more comprehensive. And as you can see from the link here, we can certainly make some of these slides available to you. We can have different scales as it relates to specifically healthcare professionals' quality of life. These ones you can see break it into more succinct and compartmentalized domains around how are we feeling with respect to the compassion that we have for others, do our work well, the propensity to actually have burnout, and secondary traumatic stress, which is perhaps more prevalent in some other healthcare professions, but certainly, pharmacists can feel this as well when they hear about trauma or traumatizing stories that some of our clients share with us, given our close relationship with patients, especially who are coming to visit us on a longitudinal basis. So what does occupational stress look like? I think, some of the different elements that we had in the word cloud started to get at some of these concepts of feeling like you're in a thankless position or a thankless profession even, feeling like, there's either chaos in the environment or it's highly demanding without any recognition. So this is where we can start building some of these pieces together. In general, there's 3 domains of behavioral symptoms, physical symptoms, and emotional symptoms associated with occupational stress. And some of these may fortunately, unfortunately, look a bit familiar, whether you recognize it in some of your colleagues and or recognize it in yourself. So sleeping problems, alterations in diet, substance use, avoidance, so your personal and or professional life, social isolation, sexual problems or lack of interest, and diminished relationships. And that can also manifest from occupational stress into physical symptoms such as headaches, GI upset. Maybe there's a rash that was there that can't be explained by anything else. And what we also might be experiencing and demonstrating are emotional symptoms, along with specifically anger, irritability, things that would never kind of push your buttons previously, or that you would be able to kind of handle on a day-to-day basis, are now becoming a bit more of a stressor. How occupational stress transitions into burnout is what is highlighted in the green box, specifically those bolded elements. So, initially when we're experiencing occupational stress, which sometimes actually can be beneficial, it can be positive. We know that similar to kind of acute pain, when we experience it initially, it's a warning for us to, hey, let's not stub our toe, or let's not put our hand on the fire. It's a way for our body to recognize some of these different harmful elements and adapt, whether that's creating different workflows within the pharmacy, or expanding our pool of ideas. When that becomes chronic and debilitating over time, we no longer have those high fluctuations in emotion, to the point where we start feeling emotional numbness, apathy, and decreased morale. And again, this is something that you might see in yourself or in your team as well. So just to compare and contrast, you can see stress may present as perhaps heightened urgency and hyperactivity, may lead to anxiety disorders, and the primary damage is typically physical. And obviously, with stress, this is correlated with premature death as well. With burnout, this is where emotions become blunted to the point where you're not feeling anything. You're feeling perhaps maybe a bit of hopelessness or helplessness, loss of motivation. And this is where we detach from people who we love and love us, and colleagues and people around you. And this is where the emphasis is more so on emotional damage as opposed to physical damage. So really burnout, it starts with a loss of enjoyment. And then, that translates eventually to a dwindling sense of self-value, pessimism, social isolation, and detachment from, again, the people who you typically would find support in. What's interesting is, especially as an organizational leader, is that burnout is contagious. So if you think about it, individuals who may not be performing at their positions because of some of the things that they're experiencing, well, this perhaps indirectly or directly offloads work onto another individual. And that person feels those acute stressors, which may become chronic stressors. So that shift in workload can actually lead to occupational stress and then eventually burnout in other individuals within the organization. So it's even more important to kind of nip things in the bud and address things as soon as possible. The other part of the contagious element around burnout is that it doesn't impact just occupational life. It impacts people's families and their family life as well. It's almost in a way a zero-sum game where, it's hard to actually keep things contained purely within the family and or purely within work, given how much overlap sometimes there is. So undoubtedly, burnout actually carries over into the family as well. And, particularly during COVID-19, there may be situations where, work from home or caretaking responsibilities are amplified, such that those two are blurring even faster than before. What's also important for us to know as clinicians, but also leaders, is that burnout can directly influence patient safety and healthcare professionals as well. There's different elements of burnout include inattentiveness and distraction. And this can certainly lead to preventable mistakes that compromise patient safety. What's layered on top of that and makes burnout a little bit more complex is that, when we avoid social connection, talking to our colleagues, we're no longer seeking feedback from them either. So we're not interested in how to improve, how to address perhaps some of those, mistakes, whether it's individual or systemic. And, to that point, we may just actually stop caring about some of the mistakes that we make. And that's certainly not a good place to be when we're thinking about our occupations and how important it is to always put patient safety first. As you can see, really, burnout is something that cannot be managed alone. And Jamie will be highlighting some of the different strategies in pulling together a group of individuals so that people aren't suffering by themselves. So in terms of causes of burnout, I won't delve too much into this because I think a lot of these are quite common sense. In terms of work-related causes, feeling like you have very little or no control over your work is perhaps something that a lot of us are facing within the COVID-19 pandemic. We feel like we have very little control over anything. With COVID-19, perhaps second wave coming sooner rather than later, I know a lot of community pharmacies are heavily debating, the opt-in piece around asymptomatic COVID-19 testing. And maybe it's opt-in for the chains, but it may not actually be opting in for specific managers of pharmacies where they're voluntold to actually participate, and therefore your staff are as well. So I think all of these different pieces, pending, the flu season as well, highly contribute to perhaps work-related causes or stressors as it relates to burnout. With respect to lifestyle, I think, again, these are highly correlated with each other. If you're feeling a lot of stress at work, a lot of different competing interests and challenges, certainly it's going to influence lifestyle as well. Obviously, again, during this current time, the typical things that gave you relaxation and gave you reprieve from work perhaps have changed. Home is no longer a sanctuary. It is simultaneously a school, a place to care for elders, while also, being a kitchen, a place to relax, and so forth. So all the different connections that we have had perhaps have changed during, the COVID-19 pandemic as well, or at least amplified in terms of difficulty in maintaining some of those close, supportive personal relationships. And then lastly, this is perhaps also a characteristic of us as pharmacists as well, around, in general, whether we pick the profession or the profession picks us, some of those personality traits around perfectionist tendencies. And, it's hard to actually maintain an optimistic view of the world, given some of the different things that we see in the media, perhaps on an ongoing basis, whether that's an economic downturn, different elections, or climate change in the midst of COVID-19. There's so many things that we cannot change that might contribute to that negative view of yourself and or the world. So I've talked a lot about all the issues associated with burnout and stress, and thankfully, we're going to end on a happier note. And Jamie's going to talk to us about resiliency and how we can actually start addressing some of those contributors to stress and to burnout so that we can mitigate them sooner rather than later. Thanks in advance, Jamie.
Okay, so thanks, Maria. That was great. So I'm going to pick up now and talk specifically about resiliency, what it is, why it's important, and what we can do to build and or further develop the resiliency that we already have. So by definition, resiliency is often thought about as our ability to bounce back, specifically after things like adversity or some kind of disappointment. And it's that ability to be able to manage and adapt accordingly, and oftentimes fairly quickly, thus the vision or the image of a ball bouncing. And so when we think about resilience, it really does describe our capacity to both manage our thinking and our emotions simultaneously, and to do that actually in a very positive light. Resilience can be described as a toolkit that we possess that allows us to manage occupational stress effectively, especially in those early stages, and some of those things that Maria highlighted earlier in the presentation. And if we can think about resilience and building our resilience and using that to manage the occupational stress that all of us encounter in our different work environments, it can help prevent us from tipping into that burnout category that is much more complicated and can be much more detrimental to our overall health. And so technically, if we can build enough resilience, it will help us to manage the occupational stress. And then if on the off chance that we tip into burnout, it actually becomes our life preserver and helps us get out of that stage of burnout as well. As a toolkit, resilience describes the menu of options that we have available to us that we can choose from when difficulties arise within either our workplace, our profession, or even our home lives as well. It can be used on a number of different fronts. Today, we're talking about it in the context of our professional and our occupational lives, but it certainly translates into other areas as well. The other thing that's important to note is that everyone's toolkit is going to be a little bit different. We don't all rely on the same thing. We don't all have the same ability with these different tools that are in the kit. We may all have bits and pieces, but each of us have a propensity to choose one over the other. And oftentimes, because for us, certain things are stronger than others or come easier to us than others. What's important, though, is that we develop this toolkit. And what we know from the literature is that the more tools that you have in your resiliency toolkit, the better able you are to manage the occupational stress as it arises, and the better able you are to get out of burnout if you happen to tip into that section. I've listed a number of things on this slide as well, and I think it's really important to highlight that one of the things around resiliency that's really important is the concept of this positive self-image and self-impression. And so resilience really does rely on us maintaining that positive self-image. And so a lot of the work around resiliency and how you develop it and grow it comes out of the positive psychology literature, because there's a lot of data to support that if you can reframe your thinking and reframe your cognitive processes to be more positive and optimist oriented than pessimist oriented or negative, the outcomes and your success are higher. And so again, I think that putting this all together, the more tools that we have, the better able we are to be able to manage our daily stressors. And so some of the things that come up as being useful and I think are really relevant in pharmacy practice are things like our ability to subdivide plans and tasks into smaller actionable steps. Many of us do this already when you're in a busy pharmacy environment and you have a number of tasks. You may need to call prescribers, you may need to check or verify orders, you may have a number of patients that are waiting and you need to prioritize the order that we do things in. And if you can figure out a plan or a routine that helps you to do that systematically in smaller pieces, it can actually be effective. And part of that goes back to that positive thinking. Our minds are actually hardwired to celebrate success. And so if you see a task in front of you that's large and overwhelming, for me right now, that's writing my PhD thesis, it looks massive. And when I think about it in its entirety, I never sit down to write because I can't even imagine how I'm going to get from where I'm at to it being completed. But if I say, you know what, I'm only going to work on an abstract or I'm only going to write 2 paragraphs, that somehow seems manageable. And when I get it done, I'm more inclined to keep going because that external motivation of having a small success provides me with enough drive to do the next piece. And so those things seem silly and we talk about them like they're easy, they're not. But again, helping us break things down into smaller tasks has been shown to increase our efficacy and increase our resilience. The other thing that's really important to talk about, particularly when we're talking about resilience in the context of our professions, is this notion of organizations versus individuals. We tend as a society to think about burnout as an individual problem that's solvable by self-care, vacation days, yoga, meditation, and learning to say no. And many of us have heard those things, and I'm probably going to tell you some of those things when we think about individual management later on. There is some truth to being able to embark on some of those individual-oriented tasks. The problem, though, is that when you think about burnout as an individual problem, individuals start to feel blamed. They start to feel like there's something faulty within them as an individual that has resulted in them having this increased amount of stress or having burnout. And they start to internalize it. And organizations think, well, it's just this person, they can't manage. It's an individual issue and we can replace that individual and we can continue to go about our business. Unfortunately, the recent literature has shown us that things aren't that simple. Evidence is mounting that applying personal Band-Aid solutions to what is evolving and becoming known as an actual workplace phenomena may be harming and not helping things. Christina Maslach is a researcher and she is the foremost expert on burnout. She actually has a burnout inventory scale that's named after her that's used in predominantly all of the published burnout literature. She actually provides a compelling illustration that helps us see burnout and its root cause, thus the picture of the canary. So I'm going to ask you all to close your eyes. I promise they won't be closed long enough that you're going to fall asleep during the rest of the talk. So trust me, close them. Take it as a minute to not focus on anything except that image of that canary in your mind. So I want you to picture a canary in a coal mine. In your mind, you see a healthy yellow bird singing away as they make their way into the mine. After some time passes, the canary comes out of the coal mine covered in soot, diseased, black, and no longer singing. Can you imagine seeing this canary and asking the canary why it made itself so sick while it was down in the mine? Well, no, you would never ask a canary that. Well, one, probably because the canary won't answer, but even still, you wouldn't ask the canary why it made itself sick because the answer is obvious. The coal mine made the canary sick, not they themselves. And so if you think about that canary and you think about burnout as an organizational phenomenon, you'll realize that individuals may experience burnout, but they themselves are not causing it. It's the organization, it's the stress, it's the flow, it's the work environment. And that organizational contribution is significant. And so if we're going to effectively provide solutions and management strategies, we need to move beyond looking at what the individual can do alone and thinking about what the organizations and the leadership of organizations can do to help support and manage the occupational stress that individuals within their organizations experience. And so there's been a really big shift in the literature to thinking about organizations and the role that they play. And this actually is important because organizations have a lot to lose if their individuals are experiencing high levels of stress and burnout, as there's lost productivity, time away from work, potentially absenteeism, as well as potentially people leaving the industry altogether. And so it's really important that this shift is starting to occur. The other thing that's really important is to start to think about the areas of our work life that in the literature have been associated as being predictive of burnout. And so this notion around conceptualizing and understanding the drivers of burnout really have moved recently towards a system factor and away from this tendency to blame individuals. And if you want an example that sort of hits close to home and that you can relate to, I would compare this actually to the medication safety movement that many of us have experienced and lived through over the last several years. When you think about medication safety, and particularly in the case of pharmacists, when we think about medication errors, there was a period of time where medication errors were really focused on the individual. An individual pharmacist, made a mistake. And as a result of that mistake, I felt terrible. I was blamed for having made that mistake. And all of the remediation was set around how to make me a better pharmacist so that I wouldn't make the mistake again. Well, we know that that doesn't work. We know that that doesn't help improve errors. We know that most pharmacists can make a mistake. And certainly many of us have and have learned from those. But in and of itself, it doesn't necessarily reduce error. And so we've totally seen a shift in the medication safety space to this systems approach to thinking about errors. And how does our system contribute to medication incidents and errors? And so that's actually what we're seeing here and this notion around this systemic perspective. And so the 6 areas that are associated and the most predictive of burnout are workload, control, reward, community, fairness, and values. And so if you analyze work life as related to these 6 domains, you can identify workplace factors that are associated with burnout, and then you can use those to lead to the development of actionable system-wide strategies that help to address it and or prevent it. And so it's really important that we think about these things. Now, thinking about workload, if you're a manager or a leader within the industry, is your staffing complement appropriate for the size of the work? How much control do you as an individual pharmacist have over your work or your team? And so again, these things are really important, thinking about them within the context of our own work environments and what we can do locally within our own pharmacies, hospital, community, family health team, et cetera. And then what we can do in bigger capacity as a organization or a chain or a profession as a whole. And so now we're going to do a little bit of an exercise to think about this notion around resilience and it being grounded in this notion around positive thinking and positive psychology. And in true positive psychology fashion, this exercise is called Find the Silver Lining. And so it really is an exercise that encourages us to look at the bright side. And what's interesting is that it sounds really easy and a little bit silly, particularly when we're thinking about an evidence-informed or a research-based talk. But looking at the bright side has actually been scientifically proven to enhance our resilience. There was a study conducted in 2014 in which participants went through a similar silver lining exercise, and their resilience was measured as an endpoint of this study. And all of the participants that went through this exercise throughout the study had increased resilience as demonstrated by being more engaged and in their work environments, and they had less negative thinking. There's a number of other studies that also support this positive impact on what they call cognitive reappraisal. And this is an example of a cognitive reappraisal exercise. And so what I want you to do now, and if you have a computer or a notebook or something, you can jot it down, or you can just think about it in your mind. I want you to think about an upsetting experience that you had recently. It can be in your work environment, it can be in your home environment, it can be anything that happened that you can, when you think about it, you already start to feel your heart rate increase that's really got you upset. And I want you to notice, first of all, when I told you to think about an upsetting experience, how you felt and what came to mind, and was it positive or negative? And then I want you to try to reframe it. And rather than focusing on the frustration of the experience, find 3 positive things that are associated with or that came out of the experience. So take a minute and do that. You may have to jot it down, but see what you can come up with. Okay, so hopefully everyone was able to think of something. When I did this task, when I was putting this slide deck together yesterday, the upsetting experience that came to mind was that I got a bill this weekend for my internet that had a $230 overage charge associated with internet use. And I was really upset. I thought, wow, $230 the first week of September. What have the kids been doing? Are they not doing their schoolwork and they're watching YouTube videos? And I was really upset. I was frustrated with Rogers. I was angry. And then I actually did this exercise. And when I reflected on it, what I learned was, A, I didn't have an unlimited internet plan, which was problematic. That it wasn't the kids that were actually going over. It was me uploading all of my lectures for the start of school for online learning. And that Rogers was actually really easy to work with. They shifted the plan, I got a better deal, and they reduced almost all of the charge. And so again, I was angry for hours, really agitated by this. And when I reframed it, a whole bunch of positive things were actually there. Now I have a better plan. I have also learned the difference between the plans, and I actually had to do my homework. And that's a small example, but I think it shows that if we can stop ourselves from that negative ruminating thought pattern, we can actually reshift our framing. And in doing that, a whole bunch of different solutions become possible, and we can see our way out of what looks like a really, in some cases, terrible situation. And so again, this silver lining exercise is really about doing it repeatedly, and around the more often you do it, the quicker you are to shift to that positive thinking mentality whenever a challenging situation or task comes up. It keeps you calmer, and it allows you to realize, you know what, this seems bad, but I've got the skills to be able to manage it. And so these kinds of cognitive reframing exercises are very effective over the long term in changing the wiring and our cognitive thought processes altogether. The other thing that's really important to address, and that comes up a lot, is this question about whether or not burnout is a mental health disorder. And it's a very common question and something that I get asked frequently when I give this talk. And unfortunately, it doesn't come with an easy answer, as we're still learning a lot about burnout specifically and its implications. Currently, though, burnout is not included in the DSM-5, so it does not have a psychiatric diagnosis. However, the World Health Organization did include burnout in its International Classification of Disease, the ICD-11, as what they called an occupational phenomenon, but not a medical condition. And so it is identified as something that can be classified. It is a phenomenon. It's within a disease classification system, but currently it has not yet been coded or classified as an actual medical condition. So That's important to note right now because it doesn't have this medical diagnostic criteria. However, there is a lot of literature that has explored the relationship between burnout and other mental health disorders, specifically depression. It's also been explored in the context of suicidal ideation. And so there's a lot of this literature specifically in health professions and predominantly in medicine. At this time, there's no causal relationship between depression and burnout that has been scientifically established. But what has been well established is that the rates of burnout, depression, suicidal ideation, and completed suicide are higher among medical trainees and physicians, as well as other healthcare providers compared to the general population. So healthcare providers, including pharmacists, have work environments that predispose us to higher rates of depression, suicidal ideation, and in some cases, completed suicide based on our work environments alone. And so that is going to be explored further in the future. And this is a very big area of research right now. And so I expect that we're going to see more data to support whether or not there may in fact be other causal relationships, or whether there is a causal relationship between burnout and psychiatric disorders, and whether or not burnout may in fact at some point become a diagnostic classification on its own. And so the other point that's really important is that if you are or think you are experiencing burnout, it's really important that you actually reach out to a physician for an assessment, because it's really common to have co-occurring mental health disorders and burnout. People that have underlying anxiety or depression are at higher likelihood to develop burnout in their work environments. And so this is something that's going to require assessment and oftentimes interventions that go beyond things that you can do as an individual without the help of other healthcare providers. Okay, so we're going to segue now into our last section to think about what can you do as an individual. And I think it's really important to leave here, as all of you are watching this talk as individuals who work within bigger health systems or in bigger teams. And so I want to highlight that although we have established that burnout is predominantly an organizational challenge, not an individual problem, that doesn't mean that there aren't steps that you as an individual can't take to improve your overall health and well-being, that you can do to improve your resiliency and to manage your current levels of occupational stress, and hopefully prevent shifting into that burnout classification. So again, you might not be able to make the system level changes that you need, but there's a lot you can work on yourself to improve your overall well-being. So I like this particular quote that says, "Ships don't sink because of the water around them. Ships sink because of the water in them. Don't let what's happening around you get inside you and weigh you down." And I think that this highlights what happens to many of us in our work environments and sometimes our personal environments. There's a lot of things going on around us, and it's sometimes hard to keep it all out. And sometimes we take it in, and in trying to work with our patients, we internalize some of this and we take on more of the burden than we probably should. And that increases the likelihood of us getting stressed, as well as potentially developing burnout. The barrier to prevent this from happening, the barrier that keeps the water out versus in our case, is actually resilience. And so what can we do? Well, we all have heard the saying that you can't pour from an empty cup. Take care of yourself first. And it sounds great, and we put it on t-shirts, and certainly Oprah says this all the time. But it's much harder to do than it is to say, as I'm sure many of you can attest to. Because when you read the strategies that I've listed to prevent burnout and to promote your overall wellness, you think, yeah, I've heard this all before. I know that I should prioritize self-care. I should sleep well, exercise, reach out and get social connection, journal, enjoy nature, try meditation or mindfulness activities. We've heard these before, and we know that they're effective. The challenge is, how do we actually fit them in, and how do we make time to do it? And so we're going to talk a little bit about that, but what I want to highlight is that the things that I've listed on this particular slide, they're all things that have solid evidence to support how to prevent burnout. And we know that if you as an individual do these things routinely and regularly, the ability that you have to manage your stress within your work environments is much higher than those who don't do these things regularly. And it actually does prevent burnout, because all of these contribute to your resiliency toolkit. And so as much as we know they are important, we tend to shove them to the bottom of our list. And so we're going to talk about how can we make some of these things a priority and how can we make them realistic within our busy life, but also our life that is now not only busy, but is much different because of our current pandemic situation. And so probably the biggest thing that we hear and the biggest barrier cited by most individuals when it comes to thinking about these individual strategies is, but I just don't have time. And we know that this is something that people not only say, but they feel. They feel they're already so pressed getting their work done and managing their lives at home that they just can't fit in another thing that's focused solely on themselves. And so one of the things that I really want to hammer home is that we don't have to spend hours on self-care. And it doesn't have to be something that takes longer than 10 or 15 minutes in some days, if that's all that you can fit in. We know that self-care is like giving our car gas. And we know that if you forget to top up the tank in the car, it won't run. And the same applies to us. And so if we don't find ways to actually top ourselves up, we are going to experience significant stress and particularly be at high risk for burnout. And so this particular exercise is one that I like. Again, it comes out of the positive psychology literature, and it's a way to help to figure out where you can fit these self-care activities into your schedule. And one of the things I hear people say a lot is, well, I don't know how to find the time. Well, I'm going to tell you, you'll never find time. There's a finite amount in every single day, 24 hours, and a lot has to happen in those 24 hours, including sleep. And so if you are working under the premise that you're going to find time somewhere, you may as well give that up right now, because it's frustrating because you'll never actually find it. You do have to make it. And so how can you do that? There's a simple exercise that, again, has been used in the positive psychology and coaching literature that actually has you assess your habits for a week. So for 1 week, assess how you spend your time. And again, it doesn't have to be a totally detailed journal, but you do have to make some time to do this activity for 5 to 7 days and write down what you spend your time doing and roughly how much of your time doing it, and rate the activities on a scale of 1 through 10, with 1 being low value and 10 being high value. Then you're going to look at your list, and anything that's really low on the value scale, you're going to replace that with items that are going to be associated with self-care and shown to have positive impact on your health and well-being. And so what was interesting is that, again, I hate to give advice that I haven't tried. And when I heard this, I was like, really? I'm going to write down everything I do for a week? Like, that's going to take time too. But I did it. And what I was fascinated by is how much time I spent scrolling through my phone, particularly news feeds or Flipboard, reading about everyone from J-Lo to an announcement that Doug Ford was going to make. And I would do it in the morning, first thing when I woke up. And I was spending sometimes anywhere from 30 to 40 minutes reading things that were interesting. But instead of that, I started to flip that time to writing for my PhD, because that was a priority for me. And I've gotten in an extra half an hour to 45 minutes a day of writing time. So again, that was something that was important to me. But again, this small activity, I had no idea. I knew I scrolled through my phone. I didn't know it was adding up to so much time. But the goal is to make sure that you replace that activity with some form of self-care, something that fills you up or makes you feel good, whether that's exercise, meditation, mindfulness. For me, it was writing, could be journaling. You need to find that activity that resonates and that's going to fit within that time. But I think one of the biggest things that we also need to think about and do is to give ourselves permission to make ourselves a priority and to make sure that this gets into our schedule as a regular appointment. A couple of other things you can do that has shown to be beneficial is this notion of shifting your perspective. And this goes back to that positive mindset and the positive attitude. Self-care alone won't do anything to change your work environments themselves or to change the teams that you work in, but you can in fact shift your perspective. And so you can figure out which parts of your job cause you the most stress and what you can do as an individual to change how you look at it, to change how you approach it, and to change how you interact within that context. So if, for example, workplace gossip is something that bothers you, you can choose to not participate, and you can choose to see it as an opportunity to shift the conversation or engage in something else. Other things that are shown to be effective is to reduce exposure to job stressors. Again, you may not be able to control these all by yourself, But you can look at your work environment and figure out where you can have control. Within your team, you can actually set ground rules for working together that all of you agree to abide by to make the environment more positive. You can learn to say no when it's appropriate so that you don't take on more than you can actually do. And there's this notion of changing our attitude to believe that the world is full of abundance versus scarcity, that there's lots of work to go around, that if I say no to this particular opportunity, another one will come along. And so knowing that this isn't the only thing available, again, shifts your mindset so that you're able to prioritize and think through what you really need to get done versus something that can probably wait a little bit longer. And again, these things sound simple, but they actually are quite hard to become habit. And so you need to practice them. These are all considered to be practices because they're not something that you can flip a switch and change overnight. And the last really important thing, and I think has certainly become even more important as we are now living in a pandemic situation, is the important role that connections play to building resilience and as a preventative measure for occupational stress and burnout. And we know that connections are the most important protective factor to combat burnout than anything else that's been studied. And so making a point to seek out connections, whether that's with family, friends, doing meaningful activities with others, those things all fill you up, and how and who is really up to you. But this notion of connection, humans are social beings, and so we need social connection as a way to inspire us and as a way to keep us well. This is more challenging now because we have to connect socially differently than we have historically, but people are getting really creative. Here we all are on Zoom and or through online platforms. So it really is different, but there's still an opportunity to see each other and to connect. And the connections from a professional perspective, having opportunities to connect with other professionals who do the same work has been shown to improve outcomes and reduce stress because you actually have a shared experience. So you can talk about the things within your work environment that cause stress with someone else who gets it. And together you can probably not only vent and share your frustrations, but you can probably also troubleshoot solutions and help reframe your thinking or see the situation from a different perspective. And so connecting with other pharmacists, for example, is also really important. And again, you can see here this notion around social connection. It's actually more harmful than obesity, smoking, and hypertension. And what I find interesting is that in 1985, the average American, and obviously Canadian data is often quite similar, the average American had 3 people that they felt that they could connect to. And by 2004, it dropped to 1. And by 2014, more than 33% of people felt like they didn't have a single close contact or friend. And so again, those numbers are concerning, particularly when we think about the important role that social connection plays in building and growing resilience. So connection is not necessarily about the numbers. The study shows them in numbers. It is about the quality. So one quality connection is as good as 3, superficial connections. It really is very individual specific and quite different for introverts versus extroverts. But what you're looking for is to have some deep and impactful connections, preferably every day. And again, I've listed a few points that we won't get into because I want to make sure that we leave time for questions. So this is really just about team wellness and how you can pull all of those things together within your environment. And so I'm going to stop sharing so that we can answer questions with all of you. I think I've stopped sharing my screen now. All right. Thank you, everyone. If you have questions, I think you have a chat box you can type them into, and they are going to make their way to Maria and I.
Jamie, one of the first questions that we've received is, how can I help or coach a peer to be more resilient?
Oh, that is a good question. So again, I think this notion around coaching and mentoring is really important, and developing resilience comes easier for some individuals than others. And so I think it's around building a connection. The only way that coaching and mentoring works is if there's an alliance, or in psychiatry, when we're working with patients, we call it a therapeutic alliance. But in thinking about it from a mentoring perspective, it's that developing of a trustful relationship or a connection with the individual so that they'll be able to hear the mentoring and the coaching advice. And then it's about working with that individual around these notions around cognitive reframing, doing some of these exercises with them, helping them to figure out where they can improve those individual self-care activities, where they may be able to shift their perspective if they've got particularly issues in the work environment. What are those issues and what are they getting hung up on? And how can you help them see that if they were to reframe that, sometimes you have to reframe things for people. They can only see it one way, but when you give them an alternative framing, because your perspective is different, they can learn how to do that themselves over time. And so it takes practice and it takes dedicated time, but it's totally something that can be done and supported with oftentimes junior colleagues that haven't acquired enough experience to do it on their own.
The only thing I'd add to that is just making sure that you have buy-in, which is an essential part of what Jamie mentioned, that therapeutic alliance, or just any alliance that you're trying to have more formally. If that person doesn't recognize that they are demonstrating, those qualities where they need to actually build the resilience, I think some of those exercises won't go very far because they may not actually be interested in participating. So I think, whether that's more of a gentle approach of, getting these resiliency exercises in the entire team so that everyone's kind of doing them, so that everyone's being kind of raising the floor, or if that person has already identified that this is something that they want to build within their personal or professional plan, and then, absolutely move forward with that, all the different strategies that Jamie has highlighted. And I think just making sure that you have buy-in versus trying to play, mind tricks on people is perhaps the most important part to strengthen the trust, as opposed to, someone thinking kind of after the fact that someone's trying to change me because of X, Y, Z.
And the other thing that works is modeling. So if you can do it yourself and show them, sometimes talking out loud, we use a lot of talk aloud methods in our research methodologies. So this notion of if you're reframing something or you're chunking a piece of work into smaller tasks, talking out loud so somebody can see that you're doing that, because no one can see your own cognitive thought processes. Again, help people observe different ways to do it. All right, we have another question. Someone wants to be more resilient, but struggle with motivating myself to employ the strategy suggested. Well, that's a good one. Maria, do you want to take a stab at that from a motivation perspective?
No, totally. It's the perfect word around motivation. I think what stands out to me is clearly you have baseline motivation to change and to incorporate some of these strategies, even prior to perhaps this webinar. And I think, what might be useful is actually thinking about what are those motivating factors to begin with. Right now we're highlighting, the struggling with the motivation, but intrinsically you want to be more resilient. So why might you want to be more resilient? Is it because you know that you have to do this in order to maintain your mental health and your physical health on an ongoing basis, so that you can, stay healthy from those perspectives? Or is it related to, you being resilient so that you can role model or support other people as well? So I think, going back to what Jamie recommended around jotting down some of these principles, as to, put it down on paper, whether that's, some affirmations that you write on a mirror or put it on a Post-it note, remind yourself why you actually want to, go down the journey of building resiliency, so that you can kind of refer back to these as you move forward. And I think, the other thing that stood out to me in Jamie's presentation, the latter half, was thinking about, you build upon your successes. So once you've scheduled perhaps that one exercise, I'm going to do this one thing differently today, or tomorrow's the day that I'm going to explore finding the silver lining by parking, 3 minutes for this activity. I've put it in my Google Calendar. Once you have that under your belt, that adds to, your Post-it notes of not only reasons to build resiliency, but actions that you've already taken and have already been successful. So I think, to me, one of the first building blocks is to think about, you've demonstrated, you've voiced that you want to be more resilient. So what are those driving factors?
Yeah, that's
Anything
great.
you want to add, Jamie?
The only other thing I would add is that sometimes it only takes 10 minutes. And if you start something, you'll keep going. So I usually say to myself, you know what, you're going to run for 10 minutes, even though you don't want to. And I give myself permission to stop after 10 minutes. If it's not going well, or I still don't want to be there, I do stop. But it's rare that I actually stop once I start. So motivation actually is something that we put a lot of pressure on ourselves to do. Oh, I need to be motivated to start. Everyone needs a push to start, but give yourself permission to stop if it's not what you want to do after you get in 10 minutes. And be compassionate with yourself. We're going to forget. Our schedules are going to sometimes go off the rails. It's okay to miss it. Just pick it back up the next day. and set small achievable goals and know your why. So
maybe the last question that we have is any online tools to assess individual or team resilience?
So there's some listed at the end of this. Bye. Sorry, someone's leaving my house. Welcome to online presentations. So I think we've listed some at the end of this presentation, and we've also got there's some positive psychology tools. If you Google positive psychology and resilience, there's an entire website that lists a number of research-based exercises. And certainly if it's not listed, we can add that and share it with folks. And I think that's it. I think we've hit our time limit. I see us being instructed to, that's our last question. Yes.
Thank you everyone for joining us. Hopefully you've taken something out of this, whether it's thinking about how to improve yourself, your organization, or how to actually reassess where we're all currently at in COVID-19 in terms of our own stress and occupational health levels. So thanks again to Jamie and again, everyone who provided the online support and for all the different discussions that we've had. I think with the poll everywhere, you got a sense that, you're not alone, whether you're either doing really well from, an occupational stress perspective, or if there's areas to improve and actually to seek out additional resources to make sure that, you aren't struggling by yourself, because I think that's one of the key pieces here. Occupational stress and burnout can't be addressed by one individual. So thank you again for all of your thoughts and your participation, and we look forward to seeing you at the next alumni event.
Thanks,
Take care, everyone.
Bye.